because we're still waiting on a lot of people are late tonight, so I grabbed some food. Jill, would you come up and just introduce what you got? She's got some really cool stuff. I love her tooth stuff. You don't call it toothpaste, what do you call it?
Tooth powder.
Tooth powder. So it's all clean stuff. So she's one of my peeps here. She's also a friend, and she's got some great products that I love. She's going to go over that real quick, and then we'll bring Dr. Claire up and start the show. Also got somebody in X-ray that's going to be in here in a minute too. So.
All right. Well, I don't even have anything planned what I'm going to say, so this is just totally off the cuff. But so basically, the company's called Honeybee Hippie, and I just started making everything in my kitchen. Kind of frustrated and confused with skincare because you go to the store and it's like, what do I use? How do I use it? So I started learning about tallow, and so we know it's good for the inside. It's the good fat that comes from beef fat basically. And I was hearing about how good it was for your skin, so I thought, you know what, I'm going to try making this tallow balm. And so that's kind of what got me started is it's so good for your insides, and what you put on your inside is good for your outside. It just really makes sense. So I don't call it skincare, it's really skin food. And so one of the main ingredients is the beef tallow. And so what I do, the good thing about tallow is it has vitamins A, D, E, and K that are naturally present in the tallow. And when you look at most skincare, it'll have added vitamin E, added this, but nothing really works that great when it's just added. Like if you take vitamins, it's better to just eat the right things than take these vitamins that are synthetic and you're adding all these things. So tallow is just complete. It is exactly what our skin needs. It's the most similar to our own skin's cells. And so when we put tallow on our skin, our body recognizes it and it absorbs it very quickly. It puts a protective barrier on your skin because everything's so dry. I mean, hopefully you're not using hand sanitizer, but you go to wash your hands in a bathroom and it's always antibacterial, and it's like you can feel it. It's like, oh, my hands are dry. So when you use tallow, you'll notice the first time that your skin feels different. What I do is I herbal infuse it, so I don't put essential oils in it. Essential oils have their place in, I guess, skincare or even healthcare, but they're very, very concentrated. They can be very harsh on the skin, and so I put real herbs in there and infuse it in there, mix it with either olive oil or jojoba oil, whip it, so you can come and you can try it. But that's one of the main products, and I've seen people, it's crazy, it's helped with eczema sometimes the first time. I've had people tell me, red faces, red whatever, they try it the first time, and I'm not saying it's a cure, but sometimes it can be that dramatic, sometimes it takes a little longer. But so there's tallow there's the tallow whips, there's tallow in the lip butter, there's a baby balm, and there's a new product I have called Miracle Mud, and it's a tallow based with bentonite clay and just different things. Put it on a cut, scrape, sore, anything, and you'll find that it'll heal much faster. And then the other one that Dr. Billy loves is the tooth powder, and that is a combination of bentonite clay, high mineral salt, powdered eggshells, which are natural. They have hydroxyapatite, which is it's a substance that you're finding in toothpaste now. They're starting to talk about it a lot. But when I looked into it, it's made in the lab, and I'm like, I don't want anything made in the lab. So it's found naturally in eggshells and in bone powder. And so I actually got the idea to put it in the tooth powder from another company, but I was reading about it. I was like, hey, it makes sense. So boil them to kill anything, dry them out in the oven, grind them up really, really fine. And you'll notice it detoxifies your mouth, it cleans, whitens, has a little mint oil in there. That's the one place I do use a little essential oils in. But yeah, so that's just part of the product line. There's some body scrubs. There's the other product I love is the Honey Glow face wash, because when you wash your face, wash your skin, again, it strips your natural oils, and most products are drying. And so what the Honey Glow does is it cleans your face, it cleans the pores, but it also doesn't strip anything. So it supports, honey is antibacterial, antiviral, if you believe in viruses, which I'm not questioning that, but it kills any kind of just dirt and grime on your face, cleans your pores, but it also hydrates and moisturizes, and it has Irish sea moss in there, which is just fantastic, full of vitamins and minerals. And I've had people using the Honey Glow and the clear tallow whip for acne, and it sounds crazy, but it's like you put good products on the face and not, most people with acne they're trying to wash their face and dry it, and it's just like your skin is almost like confused. It's like, well, now I'm dry, well, now I got to produce more oils. But when you protect the skin, your skin starts to balance. It's like, oh, wow, I'm good. I don't have to overly produce these oils. So I've seen some amazing things. you can come ask me questions. The last product I'll tell you about, this isn't the whole product line, but it's most of it, is the magnesium butter. And it's also tallow based, but it has the magnesium oil in it, and we're all deficient in magnesium. Magnesium is the first mineral depleted when you're under stress. Who isn't under stress? And you can take it orally and it helps. You can get it through foods, but taking it orally can be hard on your stomach, and so it's just another good way to get magnesium into your body by absorbing it through your skin. So that's a great product because it has the tallow, so you get the vitamins, it has some castor oil. Castor oil penetrates deep into the skin, brings the magnesium in, and then there's this, like I said, some other bath scrubs and stuff that are just, but they're all natural. Everything's organic, made with real ingredients, and there's no seed oils. That's the main thing, is using high quality fats, because our body needs it, like I said, to take, you want to eat butter, ghee, tallow, but it's good to use those types of products on your skin too, because you don't want to be absorbing, things that oxidize, which means spoil, and you don't want to be putting seed oil on your skin. So
Perfect.
that's basically it. So thank you so much, Dr.
All right,
Millie.
give it up for Jill. I probably should talk to you a little bit afterwards too. I'm just using the tooth powder pretty much. One of the things that we're going to go over, and I'll bring it up in a minute, is the fact that the reason we have so much cancer is because I just wrote an article for Truth About Cancer. I wrote it Sunday. They've been asking me to do articles once a month for them, and they wanted to understand chiropractic a little better, which I'm pretty good at explaining, I think. After 38 years, I should be good about that. And Dr. Barkey's here tonight. Would you stand up and just introduce yourself, Dr. Barkey? He doesn't need any new patients, so I don't know if you, but the thing is,
She's just here to learn.
he's just here to learn, but also at the same time, I mean, you've been a great reference for me, and when somebody really needs something, you're going to step up to the plate for me. I know I had a lady that needed bioidentical hormones that got in touch with you. So, but back to, so if you want to talk to him later, he's there. He's also got the same haircut as me, which I'd rather, like I said this to somebody, I'd rather be bald and have high testosterone than have a full head of hair and low testosterone. So, just some of the things we got to deal with as men. Okay, but I was talking about toxicity. And that's what I talked about a little bit in the article. And it blows my mind. I go to people's houses, and not that I'm snooping around or anything, but sometimes you can see that they're using Crest or all these other just super toxic substances in their house. And the reason we get all these cancers is because what is chemical toxicity, right? So these products are amazing over there. And for me, my life is really quite simple. I mean, I don't have shampoo. I don't have conditioner. I use some hemp shave cream when I shave. I use the dental powder. Is that what you call it? Tooth powder, dental powder. I floss, and I could start using your products to wash myself with. Probably I've been using Dr. Bronner's soap, and that's pretty much a healthy laundry soap. And then water. So we got the water workshop coming up in 2 weeks. That's the number one way you're being poisoned is through your water. So there's not a more important appliance you have in your house. Maybe the fridge, but you should have water filtration, because you wouldn't believe what's in your water. And you'll learn that at the water workshop. You'll learn how to clean that up best possible, depending whether you own your house or rent a house. But Dr. Claire's here tonight. She's amazing. And one of the things I want to say tonight is I don't know why we're not flooded for these things, because to me, Thermograms should be like the #1 screening tool that we do prior to doing things like mammograms. And I feel every woman in the world, and even, you're going to talk about men too. I mean,
Yep.
Okay, so let's bring Dr. Claire up, and let's spread the word on this. I mean, again, I feel like personally, I get frustrated that more people don't utilize this service that we have, and I don't know if it's because your insurance doesn't cover it, but insurance only covers stuff that doesn't work anyways.
How do I bring this down to normal?
Okay.
But he's right.
I know I'm right.
He's right.
And I'm fired up tonight.
Okay. So, first of all, thank you all for coming. Looks like a great group of people. Billy kind of saves my life with this. 2 things I want to bring up. Women. We're talking about toxic chemicals. Tampons, Kotex. Get them as far away from your body as you can. Okay? I'm going to elaborate more, but I'm telling you, this stuff is brilliant. I already put it on. I'm like, ooh, I'm already talking to her about coming to my office. So this looks like Jill has some really impressive stuff. I'm sorry, go ahead.
And so I don't forget, I had a really important question somebody asked me about genetic predisposition to breast cancer and double mastectomy in white. That's probably not a great choice.
Do you want me to elaborate on that, or do you want me to wait until after?
Why don't you wait till you get a little
You got
further
it.
on? But
You
just
got
I
it.
didn't want to forget.
I'll bring that up.
I know my personal opinion and I know how I would answer that, but I want to hear your perspective first.
Okay.
Before I put
So, and by the way, these questions I will stay and answer, and I'll try to elaborate. Has anybody here already seen this talk before? And guess what? I have new information I bring every time, and I actually have a case study that just showed up literally a week ago. And my husband hates it because I'm like, honey, do you want to add to the talk? And he goes, what are you going to get rid of? I'm like, I don't know. So we're going to find out, because I know you don't want to hear me talk forever. So anyway, this is what I call the ABCs to avoid breast cancer. The Medical Money Machine calls this month Breast Cancer Awareness Month. Yeah, I hate that term. It's Breast Health Month. And by the way, when it comes to, DeMoss Chiropractic and any of us chiropractors, it's always breast health. We don't believe in that cancer concept, because your body's been fighting cancer since you were born. And our job is to help your body do the best job it can to fight that cancer. So that's how the Medical Money Machine should be talking. But they're not very good at that. So those of you who don't know, my background, I was in medicine. I call myself, I used to be, quote unquote, a legal drug dealer. My dad was an MD. I had a very close friend of mine. Her name happens to be Yvette. She's in the blue and white. She was diagnosed with breast cancer. She did the Medical Money Machine's process, mastectomy, chemo, radiation. They told her she was cancer-free. 3 years later, she was diagnosed with breast cancer in the other breast. They did the same process, Medical Money Machine, chemo, mastectomy, radiation. We were told she was 100% cancer-free in September. January, it was in her liver, her lungs, and her brain. She passed 9 months after that. So that's why I'm here. I'm here to help you understand some of the games that's out there that you guys don't know about. Number one, the number one killer of women is heart disease. By the way, lung cancer, even though people don't smoke, lung cancer in women is much higher than men. That's the latest stat, just came out this week. My husband's belief, he thinks heart disease, and he thinks the lung cancer is because of mammograms. And I think he's right. If we had won the billions, we would have paid for the research. The reason why you don't hear about research is medicine won't pay for it, which means the government won't pay for it. And Billy and I, we can only do so much. We don't have those billions yet to do this research. But I agree with my husband. He told me that about 10 years ago in this latest research with lung cancer. I'm like, damn, I think you're right.
Right.
And I'm going to help you understand why. Here's the other thing. Breast cancer is the number one killer of women from the ages of 35 to 45. And guess what? As I drop everything, Yvette, she never made it to 45.
You were a drug rep, right?
No, I used to dispense it and make it, and I used to make all your chemos. And chemo, you guys, hazmat, right? I'm hazmated up to make the chemo drugs. My hands are in something called a hood, which is vacuum. And you want that injected into your body? No comment. So, the Medical Money Machine, I do call it insane. Deborah here talks about how medicine tells you do no harm. Well, medicine has created many different things from medicine, because I'm from it, that actually caused the problem. So, GE created the mammogram machine back in 1982. Do you know the side effect? Now, what does the mammogram machine do, right? It's there to protect us, catch us for early cancers, right? And that is medicine's approach to saving us women. But what does the mammogram machine do? It compresses the breast tissue up to 67 pounds of pressure. If you do have breast cancer, it does burst that cancer tumor and it spreads it. And 22 pounds of pressure is all you need to burst that breast cancer tumor. 67 pounds. Have any of you ladies had a mammogram?
No, they go say.
Okay, well, the ones that did, I'm sorry. Because the side effect of the mammogram is breast cancer. It will damage, now the breast tissue, I'm going to talk a lot about hormones. Breast tissue is all hormonal tissue. Well, mammogram is direct contact radiation at 67 pounds of pressure. You tell me how that's affecting that breast tissue. You tell me what it's doing to the hormones. Does that make sense? And if you have breast implants, I have so many ladies that come to me and their implants have been burst because of the mammogram machine. And it's contact radiation. And radiation accumulates. So when you're looking at Dr. John Gottman, he's a Nobel Prize winner in radiation. He says that one mammogram series is equivalent to 500 chest x-rays. That's a hell of a lot of radiation that you're supposed to get annually. And it accumulates. So your body's storing it, and your body's trying to deal with it. It is not a good thing. So I'm here to help you understand that there is a much better solution. It is called thermography. Has anybody here had a thermogram done? All the good ones? Yay, smart, we love it. So here's the difference. I'm going to tell you the difference of infrared thermography, how it works, and how it needs to be done correctly, okay? So the amazing thing about a thermogram is your phones that you have right now anywhere near your body is 20 billion times worse than my cameras. My cameras got really famous. I'm going back to 2015 when there was a big gas leak up in Porter Ranch. And you could see all the gas leaks because you could, the infrared thermography was showing you the heat. Right now, it's big because of the COVID chaos crap. So when it came to that, everybody's understanding that the body emits heat. My cameras actually can read that on medical and produce it, and you follow it with temperatures, etc. So, is it FDA approved? Yeah, 100%. Same year as the mammogram machine, 1982. By the way, infrared thermography came out in World War II. Huge. When it came to medical and military, not medical, but military use in the 50s, started out with medical use back in the 60s. It's been around a long time. You just don't know about it. You want to know why? Who's paying? Who's paying to get that information out? Is it GE? No. GE's big. There's got billions of dollars. When it comes to the infrared technology, it was military technology, no money. And come on, who's going to fight the medical money machine, right? So, no radiation, no breast mashing, no compression at all, no pain. But there's a lot of hypocrisies when it comes to mammograms and medicine and how they approach things. So first, number one is the side effect of mammogram is breast cancer. Why? Because of direct contact radiation and the destruction of breast tissue. But also, when you're looking at a mammogram, it is just getting what we call the fleshy part of the breast. And by the way, same with ultrasound, sonograms, MRIs, etc. So how much cancer do you think we get in the fleshy part of the breast? How much cancer is found there?
Chris, you know that answer.
Not that much. Not that much. Anybody have an idea? Only 30% of breast cancer is found in the fleshy part of the breast. 70% is found in what we call the upper outer quadrants. Boom, 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 boom. So is a mammogram getting it up here? No.
I'd be scared
It's
if
not.
they were.
So, the number one, what medicine called their gold standard diagnostic is missing 70% of your breast tissue. 70% of the breast cancers, right? So was that smart? Yeah, I don't think so. Now, when it comes to infrared thermography, it needs to be done really specifically. There are a lot of people out there that do it that don't follow very specific protocols. And that's one of my massive pet peeves. Okay, so first of all, in the state of California, the doctors that read the thermograms need to be what we call diagnosing doctors. So not a PhD, which in my case, because remember my dad was an MD, I was a drug dealer, kind of your pile high and deeper. So what we're looking at is has to be a diagnosing doctor. So it can be an MD, yes, they can specialize in thermography. It could be a DO, definitely. DC, right? But you have a lot of other people out there that will call themselves thermographers, and they actually could have just bought a camera because the camera has no side effect, right? It's not like the cameras, the phones you guys have in your pockets. So anybody can call themselves whatever they are and get a certification of whatever it is. Or a lot of people will do the thermograms and then they're having read by doctors out of state. So what you gotta wonder is whoever's reading those, do you think their malpractice covers? Do you think the malpractice covers any of the people that are doing that process? So be very careful of how it's done and who's doing it. And we could be dancing. Except this poor lady's like, yeah, I can't dance. I can't do it. So here's the amazing thing. Infrared thermography, 97% accurate out of Cornell University, 2008, right? Breast cancer is a 15-year disease. So when you get a mammogram, ultrasound, self-breast exam, MRI, sonogram, those are what we call anatomical or structural diagnostics. Meaning you have to have the tumor, and the tumor has to be 1 to 2 centimeters in size before it can be felt, seen, or diagnosed. Well, infrared thermography, I'm reading physiology. I'm reading the fact that this cancer has been growing for years. My job is to catch it before even year 1. But I can catch it in year 1, year 2, year 3, year 4. Way before medicine catches it at around year 8. Halfway through that disease process. When do you want to catch it? You want to catch it before it's even become anything. That's the goal. Now, we have to it's all about temperatures. So when you guys would walk through, I don't know, so you're at, whatever store. I don't go to stores. I don't like stores. But whatever. So you go through a Walmart or whatever the heck it is, and people are like checking your temperatures. Well, we can't do that. We have to have your body in very specific temperature. So we use the term 68 degrees, where it's actually 20 degrees Celsius. When therms are done, we actually do them right here at Dr. DeMoss's office, and it's done behind a privacy screen. Because guess what? We love you. But I don't want to see that. I only want to see the beautiful pictures of the thermogram. I just have a patient who just came up to me, and she's like, blah, blah, blah. And I'm like, yeah, you look so cute. And then I see her therm, I'm like, I know you. And I felt so bad because that's what I see is I know the therms. I don't see anything else. So it is, and I'm going to help you understand the physiological aspect, but it's great for dense breast tissue. Because I just had somebody else say, oh, they did a mammogram, they found out it was dense breast tissue. Well, now, I don't know if you guys know this, but there's a law in the state of California ever since 2016, Brown is the person that put it in, that if you've been diagnosed with dense breast tissue, you need an additional screening technique, not a regular mammogram. Because mammograms, ultrasounds, etc., cannot discern dense breast tissue. So what did the medical money machine do? came up with a 3D mammogram. Pretty cool, huh? So if one mammogram is 500 chest x-rays of radiation, I wonder what that 3D mammogram does. A little curious on that one. So, okay, let me see. Yay. So what I'm doing is, as I said, is I'm following the physiology, okay? So many people will do a therm, you're in a room, they take the pictures, they send you out, and then they'll say, come back in 3 months. Well, the physiology of who you were now and 3 months, 100% different. Our cells have changed, your lifestyle has changed, everything's different. You cannot actually utilize that series as much of as a diagnostic. You actually need to do it in a very short period of time. We want you to go through this process in less than 3 minutes. So first, we do a first series of scans. Then we'll put your hands in cool water. Cool, not cold. For 60 seconds. Then your hands come out, and then we do the second series of scans. I am reading your second series. I'm comparing it to the top series, but it's what the second series would call the stress study. So what happens is, are you guys all patients of DeMoss Chiropractic?
Yes.
Good, because if not, I'd say go sign up right now and become a patient of DeMoss Chiropractic. Number 2, so then you know your body has its own innate intelligence, right? And your innate intelligence knows your correct and normal blood flow, blood supply. Does that make sense? Well, when we get cold, blood leaves our extremities and we'll go to our organs to keep our organs warm. Does that make sense, right? Well, what will happen is cancer creates its own blood supply through a process called angiogenesis. The innate intelligence does not know that blood supply. So what will happen is I'm comparing because I want the temperatures to drop and I want the blood to change because new blood supply through the angiogenesis will actually stay there to feed the cancer. So that's what I'm actually looking at. So in this lady's case, right, I'm gonna make it really easy. It's not this easy, I promise. I spend a hell of a long time reading therms. But today we're gonna say blue good, blue cold, right? Red, white, hot, not so good. Does that make sense?
Yep.
So, in this lady's case, by the way, she had a thermogram not done in my office. This one was. She had a thermogram done at an OBGYN who's really famous in Beverly Hills. He does therms too. He does not do the double study. So she came back to me because she was one of my GFCA, one of my chiropractic patients, and she's like, oh my God, he put me on this, this, and this. And I'm like, I know you really well. I've known you for a long time. That doesn't make sense. So she did the therm. She's like, he told me this is bad. And I'm like going, I'm gonna do your therm. So did that change? Am I worried? No, I'm not. And I take all of her temperatures, they all go down. So as long as I know those thermal patterns, heat patterns, temperatures have gone down, and vascular patterns. So I'm reading it on 3 different aspects to make sure they have all responded physiologically that they should. Here's something else when it comes to mammograms. The number 1 most aggressive cancer is inflammatory breast cancer. Okay? This lovely lady, right? Something was wrong. She just knew it. She was like, ugh. She went to the OB. He did a mammogram. It was negative. She came back. She did an ultrasound. It was negative. She came back. She did an MRI. It was negative. See, she could have done those diagnostics, self-breast exam, etc., for 10 years. Every minute. They'd all be negative. Because those are all tumor-looking diagnostic devices. Inflammatory breast cancer, there is no tumor. So the gold standard for medicine, again, does not see or diagnose one of the most aggressive breast cancers out there. Infrared thermography. Do I like blue? Do I like this? She was smart. She went and got a thermogram. Smart lady. Okay, another thing. We often will have lumps in our breast. And then we're going to have a big scare, right? So if I have a lump in my breast that is not cancer, is it going to show up blue or is it going to show up red or white? It's going to show up blue, right? Because I don't have blood flow going to it. So this lady had a tumor right here. Did she get a mammogram? She's smart. She didn't waste her time or her money. She got a thermogram. Am I worried about that tumor? No, I'm not. So that's what you'll get cystic, fibrocystic breasts. We have a lot of things that happen to breast tissue. And guess what, men? Same goes for you. Right? Men get breast cancer all the time. And you guys rockers, right? Kiss. Chris, what's his face? Had breast cancer. Why can't I think of his name? Anyway, a lot of men do get breast cancer. So we need to be looking for any of these lumps. Any of you men, do you want to get a mammogram if you found a lump in your breast or chest? I don't think so. So would I need to get a mammogram in this lady's case? Do not. But I am bringing up things that happen with a lot of our breasts, and they're called benign, which means non-cancer. We also call them precursors because these scenarios can morph into breast cancer down the road, be it in a female or a male breast. So we always want to keep watching them. Another thing is a hormone imbalance. I can actually see that on a thermogram. So when you have a hormone imbalance, 93% of the time it's due to too much estrogen. One of the number one causes of breast cancer. And I try to explain people, it may not be your estrogen, it might be xenoestrogen from outlying factors. And I'll go over that in a moment, which is also why you want to spend a lot of time with Miss Jill here. Because all the stuff we put on our skin, Miss Jill is going to be the one who's going to save you from that. So, there are a lot of warning signs. I'm going to show you the warning signs. I'm going to help you understand something about that too. One, if you have an unusual or a new lump, you want to have that checked. But you know what? If you've gone through menopause like me, we have lumps everywhere, all the time. So guess what? Don't be afraid. It could easily be a cyst. The body lays down scar tissue every 7 to 14 days from the date of injury. You could have been kicked like me by my brother when I was in my teens. I'm getting scar tissue built up. Does that make sense? Don't worry. You just want to make sure that we check it. An unusual increase in the size of a breast. You can actually get swelling and those types of things. Did you know if you've never been pregnant and never have nursed, you can still get mastitis? So that's what it could be. That's swelling. Don't worry, but we want to check it. An unusual lowering or highering of the breast if it's going up or down. Well, if I get dense breast tissue in one breast, it's going to be heavy. It's going to drop it. Or if I have a tumor here, that's a cyst, it could pull it up, right? You want to have it checked. Don't assume. Puckering, coloring, rash, or texture in the skin. Well, she was talking about psoriasis and eczema, so guess what I'm going to tell them to do? I'm going to tell them to get that honeybee stuff. What's the name of your place again?
Honeybee hippie.
I was close. Honeybee hippie. Honeybee hippie. Got to remember that. So, a lot of different things can happen. You can have a tilted nipple that goes inside. You can have a tilted nipple that goes out. I've had people that's been that way all their life. Don't worry, but we want to check it. Any discharge or bleeding from the nipple, very important. Same goes for men, by the way. Did you know if you've never been pregnant, you still can nurse and still can lactate? So often we'll have different things that can come out from the nipples, not to worry. Did you know you can get fungal infections, right, inside the breast tissue? So again, don't assume, have a thermography checked And where are you going to do it? You're going to do it right here. You're going to come here and get your thermogram done. So there are many causes of a hormone imbalance. I basically say it like this. Any of your petroleum products, parabens, propylene glycol, phosphates, sulfates, phthalates, etc. So if it's not happening from Miss Jill here, Dr. DeMoss is going to go into it. There's a lot of things. But here's my pet peeve. Birth control pill. By the way, do you know how many I dispensed in the 80s? I have caused so many problems from my previous profession. Birth control pill. One of the worst things out there. Now, it was sitting up in our state assembly for 6 years to become over the counter. 2 weeks ago, federal government just okayed it. So state of California doesn't have to do anything. So all of you lovely ladies and your children and everybody, get them off of it, okay? The worst part is, we're giving it to girls at the age of 12 because they have menstrual pain. Chiropractic gets rid of menstrual pain in 2 seconds. We have women taking it for acne. She's got great stuff for acne. What in the heck am I doing giving synthetic hormones? Balancing your menstrual cycle. Dr. Billy DeMoss. Dr. Claire O'Neill. You get a good chiropractor. We fix these things all day long without putting any synthetic drugs into your system. And by the way, a drug is a drug, whether it's legal or illegal. Chemicals, pesticides. Here's a big one. Everybody hates me when I talk about soy and flaxseed. I've been talking about that for 15 years. And people have said, how dare you say bad things about that? But it's all coming out. It's all coming out. And I'm like, told you so, told you so. Okay, so, hygiene products. Sorry, drug dealing days. Get your subluxations fixed, please. And eat real food. She's talking about skin food. I thought that was brilliant because I only talk whole food, real food to my patients. So skin food's brilliant. So here, there's a whole bunch of things that I want you to keep your eyes on. Bras. Women, get rid of all your wire bras. Take those bras off and wear them for only, part of the day when you need them. And I talk about this. I am big. This is not paid for. I did not want it. I do not wear wires. There are a lot of inexpensive bras that are out there. I mean, even at Target, I can't do Victoria's Secrets. They give me a uni boob. You don't want uni boobs. Everybody says sports bras. You don't want the heat. You don't want the sweat. You need them to breathe. Okay? So you don't want to be flat straight across. But there are a lot of, like the bra I'm wearing right now, I paid $15 for. So there are a lot of great bras out there, inexpensive. Please get cell phones. Please get them off of you. Okay? Get them out of your pockets. Get them, women put them in here. Oh my gosh, get them off of you. Laptops. I could talk about this all day long. Okay, so now, again, infrared thermography does a lot of amazing stuff, but I'm going to give you now some quick case studies. Okay? This lovely lady, her name is Dee, right? Dee came in on July 2018. Look at her breasts, right? We like blue. Blue's good, right? Don't they say we're going to go blue's good? We're going to yellow, green, not so good, right? Depending. Always depending. So she comes back in 2021. If there was going to be anything getting worse, I would have thought it would be on this left side. But actually, in her case, it happened on the right side. So, again, I check everything because I never assume. I'm comparing everything. And if you look, most of all, those vascular patterns stayed the same. Chelsea. not good. And you'll notice something. I grade everything, so you'll see I have certain scoring systems and I score everything. So I'm watching people's scores go up and down. TH1, 100% normal. TH5, I'm not very happy about. Okay, so Chelsea came in April 2019. This was Chelsea, August 2021. How do you think she got so much better?
She ate better and she took some supplements.
It's me. What's the primary thing?
Oh, Cairo.
Damn right. Do you think she followed anything else? I couldn't get this lady to even drink water.
Oh, God.
Okay? And there I'm sucking water all day long. Chiropractic. I told her, you want to fix that? You're not going to follow my protocols? You're moving. We're just going to give you room fun. Move on and we're going to have fun. And yeah, we can do it. Here's somebody else. This is very interesting. She came in, she was a TH1 because she didn't even have hormonal patterns. There are no hormonal patterns here. May 2016. January 2021, she came in. Vascular pattern, really obvious. You can just see that blood flow right there. Right? So, this side's still good. This side, TH5. She was diagnosed with invasive ductal carcinoma and triple negative. Remember I said inflammatory breast cancer is the most aggressive breast cancer. Number 2, triple negative. Triple negative just means there's no hormonal component. She has no hormonal component when you look at hers. But it's aggressive. It's very fast. Look at that. August of 2021. What did she do? All natural. She fought like hell. And she's looking beautiful. So we can be diagnosed with these things. And is it the end of the world? No. Don't assume. Don't be afraid. Don't ever be afraid. This is what just happened. August 6, 2023. A lady, 31 years old. Self-breast exam. Finds a lump right here on the right breast at the 12 o'clock position. That was April of 2022. She went to the MD. They did a mammogram. It was negative. They went back. They did a sonogram. It was negative. They went back. They did an ultrasound. It was negative. They're like, nope, it's fine. Come back in a year. May 2023. Mammogram. Doesn't look too good. Ultrasound. No, doesn't look too good. I think we're going to send you in for a biopsy. Sad thing is I'll tell you about biopsies in a second. When they do the biopsy, it's not just one pull. It took 7 pulls in this person's case. So they go in with the needle, they pull it out, extract it, go in, pull it out, extract it. It was diagnosed invasive ductal carcinoma. Right? Now, here's my thing. If I like this, do I like that? Would a thermogram have caught it? 15 years after the fact. Remember, for a medicine to catch it, it has to get that big. Over half of mammograms positives are false positives. Over half of their negatives are false negatives. So this poor lady, and you want to know the worst part is? They don't know how to treat her right now. She came in just for a therapy. She's not a chiropractic patient. I don't even know what's going to happen. But thank you. We don't realize there are a lot of false negatives and false positives out there. But you can see it. I'm just really pissed at this right now. I'm still pissed. I feel so sorry for somebody who's 31. That medicine did what they did. So, are we going to get a mammogram? 67 pounds of pressure when only 22 can burst that tumor. Stage 4. invasive, 35 years old. Are you gonna get a mammogram on that? This lady? 2 things. Mom put her on birth control at the age of 12 because the OBGYN said her cycles were not regulated yet. And she was on Accutane. Do you guys know what Accutane is? It's one of the worst drugs for acne out there. And guess what? All came out when I was dispensing them. We were really excited in the pharmacy because we had this new drug. Great for acne. We were handing it out like candy. You gonna do that 10 mammogram? I don't think so. So, I am here to tell you guys, men, women, everybody, you start at the age of puberty and you just let us watch. And you get adjusted by Dr. Billy and you get beautiful, correct face food, skin food, and you're going to be fine for the next 180 years. So, I want to thank you. Personally.
So the specials
This is
tonight.
Deborah. She's the technician.
I'm the technician here. The specials tonight are we have 2 dates coming up in November. The first Saturday, the third Tuesday. If you want to sign up for a thermogram, you'll save $50 if you sign up tonight. If you come back next week and go, oh, I meant to sign up, sorry, you'll have to bring a bosom buddy, which is the other way for you to save. Yes,
What's the cost?
$341.
Is that with the discount or generally?
The discount comes off of that.
Okay, and
Yeah.
how often should a woman get a thermogram?
So we recommend annually,
And unless you
but
have
again,
a
what we'll
problem.
do is I'll score it, and I might have somebody come back in 6 months or 9 months, just as I'm watching things.
I've seen some places do full body thermography.
So we do, but in this office with Dr.
Yeah, we can't do
we
it in
don't
this
have
office.
the depth to do it, but we also do it. We're in 8 different locations. We're also in San Diego and in a couple of others. So it all depends on how that your full bodies are done. There are a lot of people that do full bodies and they're very general. We can do it very general, but we can also get very, very explicit. The only reason why I'm saying that is I know you're a doctor. I don't know what type, but you would probably want more information than a general, and I can talk to you about that. But I want to ask you something, right? I heard you do bioidenticals?
I do.
Okay, well, it'll be good because I will have firms and people ask me and I need people to refer to in this area. So if you're with Dr. Billy, then I know who to refer to. I'll get your information.
And can we address the question about the?
Oh, yep, are you ready?
Yeah.
Okay. So, I'm gonna kind of freak you guys out. Are you ready? I've never been checked if I'm positive BRCA1 or BRCA2. But if I was, and I was positive BRCA1 or positive BRCA2, do you see the smile on my face? Yeah, did you know that those genes actually says that our body has different aspects that can produce surfactants to protect us from breast cancer? But those genes are the first to mutate depending on how well you take care of your body. So it all goes back to epigenetics. Epigenetics. And what does that mean? That means how well you take care of your body with all the genetics you have. Again, that's a Dr. DeMoss and any of us chiros. There is one thing, since he just brought this up, and I did bring it, and maybe it's not, it might be in the office. Okay. I just had an article that I brought here for a very famous, I'm not hip on culture, a very famous model, Evangelina, anyway. She was very big, and then she disappeared off the scenes. And I ended up reading about her, and what happened is she did get breast cancer, right? And they did a full mastectomy. And in this conversation, I never got a chance to bring it up, so I'm happy Dr. Billy did, because did you know you can have a full mastectomy and still get breast cancer in the exact same breast? And she did. So what happened is she was diagnosed with breast cancer. She did a bilateral mastectomy, and then they found breast cancer in the muscle structure called the pectoralis major and minor, and she basically just said, take it all out, concave everything. So even if you have a mastectomy, even if you do a bilateral as a preventative, that doesn't stop your chance of having breast cancer. Actually, in my opinion, it will increase it. I'm going to do one last thing just to leave you with this. Say you have a lump and they do a biopsy, right? And as I said, they usually have to poke it multiple times. And the biopsy is negative, it's benign, and we're saying, thank you, God. Will that biopsy process just increase your chance of breast cancer in that breast by 67%? All yours.
All right. And the other thing is the body was created, you guys know the term holism, right? Holistic health is about every cell in your body communicates with every other cell. So when you start cutting things out of the body, like my mom, before I was even a chiropractor, I had hysterectomy, and then she had all kinds of problems because of the fact that she had hysterectomy. So it's just like even there was a show called Root Cause. Did everybody see that show about root canals and how that affects everybody's health? And they actually had to take it off Netflix because the dentists were all pissed off about it. So it's just like you want to keep your body as pure as possible, but you want to keep it as whole as possible. Does that make sense to you? Because health is, you can't just start cutting things out you're going to create imbalance. And I had two friends that had breast cancer, and their big problem is that they were both of them drank, which is sugar, right? And that's the reason we have so much cancer. There's a lot of reasons, but I think sugar is a huge part of it. And neither of them wanted to quit drinking, and then they went and had bilateral mastectomies, and both of them got brain cancer, which to me is like I'd rather get breast cancer than brain cancer any day. So again, I'm going to be real simple with what I do. I don't care if you got a friggin' wart on your toe or you got full-blown breast cancer. My way of taking care of you is not going to be any different depending on what your condition is, because I don't treat anything. Does everybody get that point? What I do is upregulate function so that you're healthier than you are before. And then you're going to do all the other things that you need to do. Yeah, we live in like people, I'm worried about the x-rays I'm taking. Don't worry about the x-rays. You got the cell phone, you got cell towers, and you're getting friggin' blasted every friggin' day. Don't give me any lip about your friggin' fear of my little x-rays when you got that bioweapon in your friggin' purse, okay? And you're living next to some cell towers. I mean, lately, I am a freak. I do a whole EMF workshop. I show you how to mitigate all the EMF in your house as much as possible. Like you go to my house, a cell phone will not even work. And I never even had a cell phone up until about 3 months ago, and I sold out. I know you guys have all been giving me a hard time, okay? I also got caught at church drinking out of plastic bottles. Somebody gave me a hard time about that. So you got to walk your talk on this stuff. That's the other thing is all the xenoestrogens that you're eating and drinking and getting in all your cleaning agents and all that stuff. The reason we have so much breast cancer is because of toxicity, xenoestrogens, all the interference with Wi-Fi. So let's just one simple slide here. The human species has lost sync. I wrote this. The human species has lost sync with vibrational tones, cycles, and harmony of life and the universe. Humans aren't sick. It's just our body's way to innate adaptation to living outside the rules of universal intelligence. We are all just victims of our own self-inflicted toxic environment. So I was telling you that I wrote an article for Ty and Charlene from Truth About Cancer, are good friends of mine. Ty spoke at one of the Cal Gyms, and we have Cal Gyms scheduled for next year. We're excited about that. Well, I have a meeting with them Friday. We'll kind of figure out if everything's going to work like we want it to work. We live in a different world than we used to live in. You guys know that, right? Mm-hmm. Post-COVID. And then I spoke. I was speaking at their event in Tennessee, and I forget who it was the keynote speaker, but he couldn't be there, and they asked me if I would be the keynote speaker. And that crowd likes me there because I'm a little bit animated when I get on stage, but they're very Christian group too, so they always say, you gotta watch your mouth. I get banned from a lot of places. I just get excited and I get pissed at the same time. It's not like I'm trying to drown you in F-bombs, but sometimes it happens, okay? Okay, so in the article I talked about chiropractic philosophy, like from 1895, our philosophy has never changed. We talked about the 3 T's, which are what? Traumas, right? We talked about toxins. And one of the things I really want to talk about are thoughts. So what you think about, you bring about. But I always forget the name of that friggin' book. Feelings Buried Alive Never Die. Is that the name of that book? Anybody knows what I'm talking about? That's the name of the book. Does anybody know that book? It's about a lot of cancers are what? Just expressions of emotional, negative emotions. So that's why, sometimes it's good to talk to people, whether it's a therapist or somebody that you need to talk to as far as keeping this thing cleared out. And I know I've been going through a lot of stress in my life lately, and I know that's going to predispose me to sickness and disease, okay? So, like you said it earlier, every one of us in here is creating 200 to 10,000 cancer cells a day. And the whole objective is that a lot of people are living their life right about here, you know what I'm saying? You know I'm talking? Does everybody know what I'm talking? So your vibration and your tone is going to determine whether or not you get cancer or not, because your body, this is what I talked about, I'm getting excited. In that article, is a sperm cell and an egg cell came together and created you, man. Right? And then those 2 cells came together, and then it was 1 cell for a while, and then it went to how many cells after that? It went to 2 cells, 4 cells, 8 cells, 16 cells, 32 cells, 64 cells, 128 cells, 256, 512, and 1,000, whatever. Okay, and then after that, then the body went from that to what? 75 trillion cells. Your body built you from 2 cells. There's an innate intelligence inside of you that's greater than any. If we took all the finite brains of man, it's smarter than all of those brains put together. So not only did the body create you, it can heal you, right? But if we do everything according to, like staying within congruence as far as living in a healthy environment, right? Thinking right, staying away from toxins, and working on structure and neurology, you're going to have a higher expression of health. Amen? So what happened? We went through that whole fiasco with what? COVID bullshit? Oh, sorry. Yes. Right? Which to me was all just a fallacy. And if you want to believe in it, you can believe in it. I'm just not a germ theory guy. That's where I come from. And I didn't get sick the whole friggin' time because I live up here. I vibrate up here. But I do all the stuff I'm supposed to, because if I don't do the right stuff, I feel it. You know what I'm talking about? If I eat shit like I ate, I ate crap last night. I went home, I felt like crap, and the next day I feel like crap. Okay? But if I eat impeccably like I like to eat, I usually feel good. If I keep my exercise patterns, if I keep my sleep patterns good, this most of all is it right here for me right now. This is my biggest challenge, is keeping my brain positive. That's why I love you guys, right? I come to the office, I get you guys, we exchange love, right? Does everybody agree with me? At least that's what I do. What do you? Yeah, sure. So, where was I? Exchanging love. Okay, so that's one of the most. So that's what I talked about. There's 2 things that cause disease. One is what? Toxicity. We already talked about that, right? And the other one's deficiency. So what were some of the things that people were deficient about during COVID? They didn't get the love. They were socially excluded from the family. We had what? Fear. We had lack of exercise. They couldn't go to the gym, but they could go to the strip club or they could go to the bar, right?
Right.
So everything that they promoted were things that created a lower frequency, right? Amen? Okay, they didn't promote things like social interaction like we did at the Freedom Cruise. Is everybody leaving now? Am I scaring everybody?
No, it's going to get moved up.
I know it's getting late. So Ty and Charlene really wanted me to touch on the chiropractic part because everybody's got this like weird misconception about, well, I don't have any pain. Why would I go to a chiropractor? Well, do you wait till your car's on fire before you take them to the friggin' mechanic? No, you don't. And just like today, I had a new patient. she's not here anymore, it was her husband. He came in, he didn't have any complaints, right? No complaints, because guys are always tough, they don't want to ever tell me their complaints. Until you find out what's really going on with them, then they come out and tell you everything they didn't want to tell you on day one, you know what I'm saying? It's called minimization. They minimize their problems. Okay, so I take x-rays, he's got like bone-on-bone degeneration in his neck. He's 10 years younger than me. He's got bone-on-bone degeneration in his low back. When are you going to, like, see, what I try to get people to understand, it's all about what? Prevention. You don't wait till the fire alarm's going off in your house. You know, you want to prevent the fire, right? So, again, most people go to a chiropractor and what? Their pain goes away, and what do? They quit going to the chiropractor. That's not what, that's why people come to me, but then I try to teach them. That's why we go to all the extent to teach you all these workshops. Somebody asked me, does your brother do the workshops in Orange? No, he doesn't do the workshops in Orange. It's not that he's just not, I love teaching. Doctor means what? It doesn't mean drug dealer, it means teacher. And like so, and sometimes people think I'm anti-medicine. I'm not anti-medicine, I'm just anti-stupidity. I mean, you don't, like your body created you from 2 friggin' cells, right? And it built 75. Why would we, on day one, start sticking needles in this kid with all kinds of toxins? You know, you wouldn't even eat the crap that's in that vaccine, let alone inject it and mainstream it into a kid's bloodstream. And you guys know I'm very vocal about that. That's why some people don't come here for that reason. You know, people come in and they look at the front desk, they see the books out there. We used to have the COVID is the scam shirts and hats. And people, you know, some people walk in with their Wall Street Journal or their New York Times or LA Times or whatever it is. And, you know, I know they're not a fit. I mean, I don't want to be for everybody. In fact, I thrive on the fact that most everybody that comes here gets it. And sometimes I'm worried when somebody comes in that doesn't kind of get it, because they're going to get blown out sooner or later. You know what I'm saying? And it's not like I'm trying to be mean or cruel. I'm just trying to get people to understand what? The truth.
I'd say that's the opposite.
What's that?
You're actually being beneficial to them. You're not being cruel.
Of course, but some people, like when you, they've been brainwashed to believe everything that they believe, and then there's this bald-headed, loudmouth, bow-legged chiropractor that is trying to get them to understand simple concepts. Hey, just show me the proof.
You're a walking advertisement.
And 38 years of practice, never sick, except for mental sickness, okay? That's a different story. And that's why I take vacations, right? We should all take vacations. So, let me just blast through these slides real quick. But the whole thing is about raising you up. You should be eating impeccably. Like, I went to the beach today, the waves didn't look that good, but I went out, I sacrificed that hour to go out to go surfing for an hour. You guys feel sorry. And then I got some cold water therapy in with it, you know, and I paddled and I was grounding in the water. I was out amongst, you know, the seagulls and the pelicans and dolphins. You know, I'm getting that nurturing love, getting connected to the universe, right? And it was because I had a busy morning in here getting CalJam stuff going, and then I went and took my break. I went home, I'm doing the carnivore diet right now, went home and cooked my steaks. And I'll probably do the same thing tonight. Eat some I think I'm having shrimp tonight. All right, so this slide's basically saying women have been exploited by the medical profession, okay? Never before in history has medicine made healthy women been persuaded, frightened into having one or both their healthy breasts surgically removed for a condition they don't have or may never suffer from, or for a genetic mutation that may never threaten their lives. That person already left. So, like we talked about epigenetics, these are the 10 factors. So this is the one, like, everybody knows they should eat right, they know they should exercise, they know they should get good sleep. Some people know about grounding. I'm currently doing detoxification. I'm working with Hank Williams right now. We're working on, I just did a liver cleanse. I'm working on prostate stuff right now. I'm going to do some heavy metal detoxification. I'm continually detoxing because we live in a hugely toxic world. You know, my lead's through the roof, my mercury's through the roof. I think my mercury's through the roof. And it's not from vaccines. It's because I'm in that ocean all the time. And I ate a lot of swordfish as a kid. Okay? Then be happy. So I do breath work before I fall asleep, right? And I do breath work in the morning when I get up. And when I'm doing that, I'm giving thanks to God for all the stuff that's positive in my life. okay? Because it's hard to be negative when you're. I also talk about the benefits of cannabis and psychedelics. In fact, somebody just, one of the patients that came to the brain workshop that had a stroke, he sent me 5 articles on just how psychedelics are improving brain health for people with TBI and stroke. So again, you can look at conventional stuff, which is orthodox medicine, or you can look outside the box if you really want to get into truly. And again, the same thing with cancer. Like we've got hyperbaric here. I've worked with people like prostate cancers through the roof because everybody's putting you guys know not to put them here anymore because you're all walking around with them here right now, right in the back pocket, which is frying what? Your ovaries, and you got all those problems with infertility. Yeah, I got the stupid cell phone, but I don't carry that thing around with me. In fact, I haven't even looked at that thing all friggin' day. So I'm probably in trouble, right? Because you got to text everybody back. Text people back. It's the worst tool on the planet.
Yeah, it is.
I'm just venting a little bit. So I do 4-7-8 before bed. I do Wim Hof in the morning. I am a horrible meditator, but I get my meditation when I do the breath work. Okay? Let me blast through. Get adjusted. This is what we do. It's a chiropractic. It's not about a pain, it's about nerve interference. And I always tell people, if you have pain, it's probably a good idea that you have pain because you actually realize that maybe a chiropractor can help you. But like that same person I was telling you about earlier, the husband that came here, and he didn't have any pain, but he was reading all the things on the books. You asked me about GI stuff, I forgot to tell you about my stomach problems. And so he's reading the testimonials on the wall. He goes, I have to take Zyrtec for that every day. He's on 2 different high blood pressure medications. They told him he needed to take statins. So he's having problems with what? Libido, right? Because blood pressure is going to lower libido. It's also going to lower your effects of your male strength, okay? And the statins are what? Lowering your production of testosterone in the body and also decreases cognitive function in the long run. I'm not a big fan of any drugs unless you've done everything else first, right? Like if you got high blood pressure, there's a reason your blood pressure is high, right? It's not your body creating from those 2 cells, right? So it's elevated your blood pressure to adapt to your environment, whatever stressor it is. Like I was going through massive stress 2 months ago, okay? My blood pressure was through the roof. Did I want to get on medication? I knew it was a temporary thing. I took my blood pressure this morning. It was 109/70. And if I would have went to a doctor, they would put me on medication. I would probably be on it the rest of my life, right? Ask your doctor when you're going to go off your high blood pressure medication or your statins or whatever other drug you're on.
Some doctors.
Some doctors, true. And that's true. I'm not trying to beat you. I'm just saying, yeah, you get it. But how many doctors think the way you do? 10% maybe? If that.
If that. So we appreciate docs like you, we really do.
Yeah, so what we work with, a chiropractor works with is nerve interference. So why does a person have high blood pressure? Because they're what? They're in a sympathetic fight or flight physiology. So when you're like a tiger's gonna eat you, is your blood pressure gonna go up? Heck yes. Is your heart rate going to go up? Heck yes. Is your blood sugar going to go up? Heck yeah. All that stuff, normal physiology. So when we adjust you, that's what I talked about in the article, we shift you from a sympathetic dominant state into a more parasympathetic state, which is a healthier physiology. It's rest, digest, heal, and procreate, right? So what improves? Cognitive function improves. Like where'd that guy he's coming back this week. I had an older person come in that I met at the Beamer workshop that we did, and he goes, it's kind of weird that after you adjusted me, I could think better. I go, yeah, of course. Because your whole nervous system works together. And the highest density of the mechanoreceptors that feed your brain is upper cervical stuff. So, again, I'm not saying, I am saying this, is that the number 1 disease coming down the pike is what? Cognitive decline, yeah. And it has to do with everybody's hideous posture, restricted range of motion, upper cervical, sugar. That's why we got all these people with cancers, because we're feeding them sugar. We've got all the EMF. So everything that you can do and all the poisons and crap in your water, so you can control your destiny by controlling what you do in your lifestyle. Get exercise. How many people don't exercise? You should train, I can say this, you should train like you're a professional friggin' athlete, in my opinion. Because what is more important than your health?
Nothing.
Nothing. You can say God, but God wants you to be healthy. So that's a cop-out. Okay. I go to church. Okay, so I get to God then. I go to church at Beach Cities and I go to the church at the Pacific Ocean. Okay. Not bigger, better church than the Pacific Ocean, let me tell you. That's why I haven't moved yet, okay? Like half my practice has already moved out of state because that's the kind of people I attract. Yeah, and everybody thinks the chiropractic's about back pain, sciatic, neck pain, headaches, but this is the slide that tells the story, okay? So, and if you have a subluxation, let's say it affects your respiratory function. If you're not respiring and not getting enough oxygen, what does that leave you more susceptible for? Cancer. What does cancer hate? It hates oxygen. And we live in an environment where over the past 200 years during the Industrial Revolution, we've cut down all the trees and we have lower and lower percentage of oxygen in the air that we breathe. I bought the hyperbaric for myself. I was in the bathroom thinking about, I have a friend that sleeps in his hyperbaric. He's a chiropractor, okay? He doesn't share it with you guys, or with his patients. I bought the hyperbaric for me, and I don't get in it enough, but that's if you had cancer or had concerns about it, that hyperbaric would nail most cancers out. And then getting more alkaline in with your diet and through your water and eating clean, healthy foods. Like we got in the hyperbaric tonight, right? Mm-hmm. To heal, it's going to increase the healing potential. All the plastic surgeons around here would benefit from that because it increases healing potential. We have the Beamer over there, which you didn't talk about, which opens up the circulation. Open up the circulation, hit it with oxygen, lower the sugar, start thinking positive thoughts, eat healthy, get some exercise, do some grounding, get adjusted. I mean, you're going to be bulletproof. Mm-hmm. Like I was hugging people and adjusting everybody through the whole COVID thing, and I didn't even get a friggin' sniffle, man. I thought it was a joke. I laughed about it the whole time. I would go to friggin' Sprouts with my V for Vendetta mask on and a wig and just freak people out. If you want me to wear a mask, I'll wear a mask. I had fun with it because I knew it was a scam from the beginning. Why would they promote a scam? Because they're going to sell you a vaccine like they do with every other scam. See, you don't get sick because germs attack you. You get sick because you suck. Right? You get sick at playing the game. I don't have time to exercise. Well, yeah, you don't have time to exercise, but you got time to go to the hospital for 2 days, right? Or lay in bed for 3 days. I got a lot of work to do. All right. Yeah, I just talked about the germ theory. Endocrine disruptors. Your water is horrible. Just go Google your water and see what's in your water. We have a water workshop coming up in 2 weeks, okay? Everything's in there. That's that. There, you talked about the bras. In areas of the world where they don't wear bras, they don't get breast cancer. They probably don't have all the crap that we have going on here either. Hair dye. I don't have to worry about that. But there's 5,000 different chemicals in hair dye. You know? So, if you'd rather get cancer, I'd rather have, I think I'd rather have gray hair than cancer. Then I'm big on the detoxification stuff, so that's what I'm going to do next. I'm going to do the heavy metal detox test, or detox next, with Hank. What does this slide say? That's your water, your phone in your back pocket, radiating your ovaries.
Billy, who's Hank?
Hank Williams. He's a functional medical chiropractor in Laguna. He does the detox workshop with me. He's my chiropractor. Dr. Joe's my adjusting chiropractor, but he's doing my detox stuff. Sugar. Everybody gets an amen on that, right? It's not even sugar. It's what? High fructose corn syrup sprayed with what? Glyphosate. Okay, just minimize your sugar.
Just bad.
Plant paradox. So that's why we got into the whole carnivore diet because of books like Gundry's book. There's also the book Toxic Superfoods. Remind me of her name again. Doesn't matter. Toxic Superfoods talks about the oxalates that are in your foods. This is lectins. So there's a lot of, what's that?
Saccharins too, I believe.
Yeah, there's all kinds of. Come to my, I'll probably at the beginning of the year do the carnivore workshop again. We had 60 people in here for that workshop. And the cannabis one gets like 60 people in here
Did you
too.
serve steak at the carnivore workshop?
You know what? It's so funny you say that. I cooked that night. I'm not doing it again. 'Cause it was a lot of work. I made this whole huge thing of chili with no beans in it because you can't have beans either. It was just meat. Okay? Yeah. I went to my secret spot grocery outlet and bought all the freaking grass-fed ground beef and cooked it up for you guys. Okay? Now what else is there? Mushrooms. So there's other ways to deal with this other than a 1940s technology, which is chemotherapy. We could do things like turkey tail mushrooms. I could tell you stories about that. But again, I get people that come to me with full-blown cancer and they go back to the doctors and the doctors are blown away because we're working with them together about the results they're getting here just from doing hyperbaric beam or getting adjusted. And when you get adjusted, your level of immunity goes up like 400%. Okay? Sleep, we talked about that. We talked about cannabis. It helps with all this stuff. Like I just gave you some. I don't know why I gave it to you. I just felt like I'd give you some. And you've been doing great with the sleep, right?
Magic.
Yeah. And it's again. You know why it got such a bad name is because in 1937 the medical profession wanted to eradicate us using plants and mushrooms too. 40% of drugs are synthetic versions of mushrooms, of constituents that come from mushrooms. So I mean, I take it every night before bed. I'm a freak. This is the kind of stuff. I have a whole protocol before I go to bed. It takes me about 15 minutes to go to bed every night. Okay. And again, I'm not treating any of these conditions. What I'm doing is upregulating. So the best thing about cannabis is it lowers what? Inflammation. All these diseases that we have typically are a result of being in an inflamed state. I'm almost done. So there's the products we have. There's the Beamer. These are great books. Come to my EMF workshop to learn how to mitigate it. Get all the crap out of your room. Like I don't even have an electric alarm clock. I have an alarm clock that runs on a battery. And that actually, the battery ran out the other day, so I had to come here and get another battery. So minimize everything in your bedroom. That should be a sanctuary for you where you sleep. No TV, right? No computers, no phones, none of that stuff in there. The only thing I have in there is an air doctor, and my EMF guy checked it. The air doctor had very low EMF that came out. Those are two great books, though. There's a hyperbaric. What's the special there? Okay, it says $125 for one session. If anybody wants to try it, like I did with you tonight, $50 for your first time in there, okay? And then we'll work something out that's affordable for you. It's all about your curve in your neck. What is detox? I take this stuff. It's on my desk. Helps with iodine, and also helps with a lot of the radiation, not only from electromagnetic radiation, but does everybody remember Fukushima?
Yeah.
Anybody?
Mm-hmm.
Yeah.
Okay. I bought a Geiger counter. That's how weird I am. To check the water that I'm surfing in.
I would if I were you.
Yeah, I would. I'm going to probably check it again. All right. The pill. You talked about the pill.
Baby.
And then I'll just close with this baby thing. I hope it works. Does it work in the video? Yes, it So, in fact, I just had a call with Chris Lippy this morning. That's his son, Luke. Chris Lippy wanted to be at the birth of his baby. Lori Walker was the midwife at South Coast Midwifery. I'm trying to talk so fast that I'm putting words together. And, of course, what time did the baby have to come?
Like 2 or 3 in the morning.
Thank you, 2 o'clock in the morning. So they called me at 2 in the morning to come over to South Coast to adjust the baby. I got to work at 8. That's not really. I could always call Joe too. So no big deal. And I get to the midwifery center, South Coast, and mom's still going through labor, and she's in there, screaming and all the stuff that women do when they're going through labor. And at 3:30 in the morning, I've never been so grateful to hear a baby cry. And it was like, amen, the baby's here. I can go home in a little bit. 3:30 in the morning is late, okay, even for me. And then they came and got me, and I adjusted and the baby was crying and crying and crying, and then it got adjusted, and then right after the baby got adjusted, he was looking for a boob, and that's not my department. Okay? So it's not only, chiropractic's not only important for us as adults. Like, people always go, well, why would kids need it? The kids need it more than adults do, right? Because it's better to grow healthy kids than fix injured adults. So your spine, like things like scoliosis, your spine's in its formative stages, right? And if things are out of alignment to begin with, especially, I could go on and on about stories because I've been doing this for 38 years. If you've got upper cervical stuff, that's going to predispose somebody for scoliosis or SIDS, or a lot of the things that people don't think about that happen in life. There's always a cause to every problem, right? And a lot of it has to do from birth trauma to vaccine injuries to all the other stuff, okay? But the objective is, if we can free up this nervous system, the body's going to develop healthier than if it's not chiropractically maintained from womb to tomb like we do, okay? All right, so if anybody's interested and is not a patient, we have a special for $80 for your exam, your x-rays, your first adjustment on day 1, and then you come back on day 2, you get another adjustment, but also we'll go over all your x-rays and explain to you what's going on, and then you can decide what you want to do after that, okay? If you want that deal, you have to step up to the front with Fatima at the front and get that. Does anybody have any questions? I know we went a little late, but not too late.
I have a question. Do you still have do you still sell the eyeglasses here? The red, the blue light blocker, the red, because you had you don't have them anymore?
No.
Okay.
I could probably find a pair at my house that you could have. Because I have about 3 or 4 pairs of those. Any other questions?
Do you guys have any questions regarding thermograms?
I go have one. It's easy to do them yearly. I did my first one last year, so I'm coming for my second one. Do you compare each year?
Always. I compare everything.
And
That's
when
why
is
it says it's a lot longer than it thinks to read them.
when is the next one scheduled?
First Saturday of November, and then the third Tuesday of November. So if you want to sign up, the clipboards are there, and make sure you take a health history form with you, bring that back with you on your appointment date.
And
They
like
had say $50.
and like I was saying earlier, I'm just like, I get so frustrated with, it's like medicine's this huge Titanic. It's so hard to turn that big boat around to get people to understand like the benefits of this versus doing a mammogram. So that's why I implore you guys to go out and spread the word if you can. I mean, I don't know why we're not booked every day you're in here. Sometimes
We
I come
should
here.
be.
And
We really should be.
I know. And, prevent people from subjecting themselves to mammograms. And I don't know where you think mammograms should be in that whole screening process, but obviously toward the end.
It's further down the road, yes.
But we're here to help. We're here to really change consciousness and really change the world so that these kids have a better place to live in. So I'm going to shut the heck up. Get the heck out of here.